We need to look at food sensitivities, inflammatory foods you're eating. We need to look at potential chronic infections that are causing it. We need to look at what's going on with your mitochondria. Mitochondria is what makes energy, what's called ATP, which is what our body uses for energy.
You're listening to the Integrative Medica podcast with Dr. Jake, a licensed naturopathic doctor who will show you how to tap into your body's natural ability to heal your health issue and improve your symptoms quickly without harmful drugs or devastating surgeries. So pour some tea, get comfortable where you are, and enjoy this healing episode.
Welcome to the Integrative Medica podcast. Our show today is on the natural approach to fibromyalgia and how it may differ from the conventional approach that you might be hearing from your doctor or the mainstream news. Dr. Jake, let's sort of get started right now. What is fibromyalgia?
Personally, fibromyalgia is not an awesome diagnosis. It's a diagnosis that a lot of doctors give is we don't know exactly what's wrong with you. We don't know what's causing your pain. We don't know what's causing your fatigue. You have pain in these certain areas, which is just like people with fibromyalgia hurt everywhere, but they press these certain areas on the body and they say, oh, this person has fibromyalgia. We don't see anything on the laboratory work that's an issue. We don't see any imaging problems. So you have chronic pain, fatigue. Let's give you this fibromyalgia diagnosis. So it's not a perfect diagnosis. It's a blanketing term. But I specialize in fibromyalgia because I specialize in figuring out what other doctors don't know or figure out what's causing what's going on instead of just covering up the symptoms.
Okay, so I want to dig into that for a quick second because I was diagnosed with myasthenia gravis when I was diagnosed with stage 4 thymoma cancer. And that was sort of a catch-all even. At least that's what the doctors told me. It was a neurological sort of thing.
Yeah.
So if we don't know exactly what fibromyalgia is, can you maybe tell us what it isn't? How do we know it's not MS? How do we know it's not MG? Like, what are some of the defining characteristics of fibro?
So a lot of times they're going to rule out those type of things if you go to a conventional doc, or if you came to me, I would rule those things out too. But most people come to me when they've been to several different doctors. They've already had all these type of diagnoses ruled out. And we already have had done certain imaging, and we've done some laboratory work to rule out what could be possibly causing the pain. So like, let's rule out multiple sclerosis. Multiple sclerosis could cause pain and nerve pain throughout the body. So you do an MRI of the brain to see if they have these little spots on the brain that could be related to multiple sclerosis. They want to rule out if it might be something really going on with the back. So you do an MRI of the back and you do special physical exam the doctor does to see if it might be related to something physically wrong with your back or your neck or your shoulders or whatever. So they rule out all these orthopedic things through imaging, x-rays, and physical exam. And then they order some certain blood work to see if there's anything that could potentially be causing the pain. They do a basic thyroid panel. We'll dive into that in just a sec. They might rule out certain autoimmune conditions. So they order like an ANA or RF, et cetera, to make sure it's not related to autoimmune disease. So there's a lot of things they do to try to find out what's going on. And if all those things are negative and you still have muscle pain and chronic joint pain and you're tired all the time, they're going to give you that diagnosis.
Are there any other symptoms that are characteristic of fibromyalgia that you could share with our audience?
I mean, those are two of the main ones, but a lot of people that do have fibro many times have some anxiety, depression. Many times they do have migraine headaches. A lot of times they have digestive stuff going on, maybe constipation or diarrhea, gas, bloating. They might have hormonal dysregulation, really bad PMS, stuff like that.
It sounds pretty like it could be easy for someone to just think that it's not fibromyalgia, it's just this or that or the other. How long does a person, in your experience, sort of like live with the symptoms before they come out and decide like, hey, I need to get a diagnosis and fix this?
Probably 5 to 10 years.
5 to 10 years?
Yeah, mostly. Yeah. I mean, some doctor, they might go to a doctor and they quickly give them the diagnosis of fibro. I'm not a huge fan of giving people's labels though. I don't like to be like, hey, you have fibro. And then they get to go tell everyone that they have fibromyalgia. I guess it can help them to actually have an answer though, but it's getting that diagnosis of fibro really isn't just like, it's not a true answer because really in the conventional realm, they have no idea what to do. They're going to give you pain meds and antidepressants. That's what they're going to give you for fibro.
I want to talk about the conventional medicine approach and how your approach is different. Maybe we should first talk about causes. Like what causes this fibromyalgia or the symptoms that we call fibromyalgia?
So there's a ton of things that can cause fibromyalgia. There could be a dysregulation of your thyroid, but you have to really dive deep into that, not just do a basic TSH, which your doctor probably has done in the past. To identify that, you have to do a detailed TSH, free T3, free T4, reverse T3 to really understand what's going on with the thyroid. We'll go into more deep identification of that in a sec. We need to look at your adrenal glands, how those are functioning. We could rule out some of the more severe things like Addison's or Cushing's disease, but those probably have already been ruled out if you're coming to me, but maybe not. Then we dive into that. Usually there's a functional issue going on with your adrenal glands. You just have too little of cortisol being produced or too much, but it's not in the realm of Addison's or Cushing's. We need to look at food sensitivities, inflammatory foods you're eating. We need to look at potential chronic infections that could be causing it. We need to look at what's going on with your mitochondria. Mitochondria is what makes energy, makes what's called ATP, which is what our body uses for energy. All people that have fibromyalgia have a dysregulation of the mitochondria and trauma to that. We need to look at detoxification because many times they've been exposed to a lot of different toxins, maybe emotional toxins, but also physical toxins like herbicides, pesticides, poor air quality, fungal mycotoxins, etc. Then we work on balancing out the neurotransmitters in a natural way, not just suppressing a neurotransmitter or just increasing a neurotransmitter like a antidepressant or anti-anxiety med would do. And then we work on balancing the brain waves inside the brain. It's a big piece. There's a lot of moving parts, and usually one thing is not the cause, it's multiple.
If a conventional doctor heard you say what you just said,
yeah,
what would they say?
It's a good question. I just don't know exactly what I'm talking about in this regard. They haven't really specifically been trained a great deal in fibromyalgia in the way I'm looking at it. Their training is different. Here's the difference is they follow a philosophical model called allopathy, meaning they identify the disease, and if they eliminate the symptoms of that disease, the disease is cured. My philosophical model I follow is called naturopathy, which identifies the disease, and if we eliminate the cause of that disease, the disease is cured. So that's different than the conventional approach, which they are working on fixing those symptoms. That's why they give you antidepressants and certain pain meds, because they're treating that specific symptom, but they're just covering up what's really lingering behind, causing all those symptoms. So when I'm talking about all these things, they might agree with a lot I'm saying about the thyroid and the adrenal glands. Again, they don't know a lot about nutrition, so many times they don't think that's a piece there. So some things they're definitely, believe me, in the neurotransmitter realm, because they think fibro is mostly a psychological disorder.
Okay, that's interesting. And that was my point, was that the doctors just don't know. They're not evil. They're not bad. They're not trying to cover up the cure. Mm-hmm. They just haven't been trained on this. And that's why it's important where if you're experiencing these symptoms, that you go to somebody who's trained in recognizing these symptoms. But you would just mention something like the pills and stuff they give to cover it up. What are some of those pills that they prescribe? Why do they prescribe them?
Prozac is a very common one that they're going to give you. They're going to give you lorazepam. And sometimes they give you Adderall. This isn't necessarily antidepressant, anti-anxiety, but they do prescribe that a lot. They give sleep pills like trazodone.
Are these designed to eliminate physical, like change your biochemistry? Or like you said, they think it's psychological. They think it's all in your mind.
Yeah, so they're changing your neurotransmitter uptake, and most of these are working on changing your serotonin or dopamine levels inside your brain. Or the anti-anxiety meds are having an effect on your GABA receptors in your brain, which calm the brain down. So they're just blocking certain reactions in the body to increase serotonin or increase dopamine. They're not helping the brain work in a certain fashion. They're blocking certain reactions to increase a certain chemical inside your brain to make you feel better. Increase serotonin, which is a good feeling hormone.
Are you able to feel better without the pills after a certain amount of time?
No, if you don't take the pills, you won't feel better. A lot of people that take the pills don't necessarily feel better with their fibro. They feel a little better. Many times they have to take the pain meds to really feel all the way better.
And is that a high? Is that kind of like a high? Like they're just kind of high on pills and feeling good?
Yeah.
Wow.
Mm-hmm.
Wow.
And then they have to take more of a certain pill because they start getting used to it. Reason why is because the cause still hanging out there, right? You have to keep on taking more, increase your dose more and more until you get to the point that you can't increase your dose anymore. And then you're just in pain all the time. Your mood might be a little better. Maybe you're not as depressed anymore. Maybe you're not as anxious anymore. You probably still have a little bit of that going on, but your pain's still there and your fatigue's definitely still there, because many times a lot of these medications make your fatigue worse.
Wow. Okay, so that's depressing. Thank you, doctor, for that. That's our show for today, everybody. So well, luckily we're not going to leave him there. Let's talk a little bit about then your approach, the integrative approach, the natural approach to fibromyalgia. Talk to us about that approach and how you would handle it differently.
My big goal when you come into my office is I'm going to ask various questions to identify what is the cause and what we really need to dive into and what specialized testing we need to do to really identify that cause. So let's dive into the thyroid, okay? So maybe many of you guys that are listening to this have gone to your doctor and you guys have gotten a basic TSH. Maybe you thought you had something going on with your thyroid because you were tired. You read online that, oh, hypothyroidism is very common for fatigue, so I'm going to go to my doctor and have him check that out. So then they run something called a TSH. And what I learned in my basic medical school training is that if you check a TSH, there's a feedback loop, and that's all you need to check because there's that feedback loop. But then when you get more training into the thyroid, that's not necessarily true. We need to look at the TSH, which is a chemical that is produced by the pituitary gland in your brain, which then goes and talks to your thyroid gland and says, hey, let's make some T4, buddy. And then T4 needs to be converted into T3. And then T3 needs to get inside the cell. So there's a lot of certain mechanisms of action that could have an issue that could lead to hypothyroidism. So if you're just ordering a TSH, you're missing out on the T4 that might not be being produced when the TSH is telling the thyroid to make T4. You might not be seeing that your T3 is too low because you're not converting your T4 to T3 very well. And then you also might be missing that the T3 is not getting inside the cell very well, which can be related to cortisol imbalances. So there's a lot of pieces to the thyroid that's likely not been looked at by your conventional doc. Another cause is the adrenal glands. So there could be a dysregulation of your adrenal gland function, which can happen from chronic stress in majority of the cases, either psychological or physical. You're pumping out too much cortisol all the time, or you're taking too much stimulants, like you're doing the pre-workouts and you're taking tons of coffee, which is them pumping cortisol out of your body all the time. And then over time, your body's like, hey, I can't keep up with this anymore. And your adrenal glands are like, hey, I can't make this cortisol all the time. I'm going to start decreasing my cortisol production. And guess what cortisol does? It increases energy, focus, concentration, decreases inflammation in the body, balances out our blood sugar. So if you don't have that working very well, you're going to be in pain and be tired all the time and have headaches and imbalances your neurotransmitters, leading to anxiety, depression, etc. So that's a big piece that we need to go after. It's looking at the functional issues with the adrenal gland, not just the severe Addison's disease and Cushing's disease, because many times that's not really what's going on with fibromyalgia patients. Then we need to look at the foods. Food sensitivities are a huge thing. Certain foods you're eating can cause this inflammatory response and could cause inflammation in your gut. And guess what? We have a ton of neurotransmitters hanging out in our gut. So if you eat in a food, let's say gluten, for example, or dairy, that's causing an inflammatory process in your gut, causing some damage and degeneration in there, opening up what's called your gap junctions. And then certain foods and other chemicals are able to easily get into your bloodstream. This is going to affect your inflammation. It's also going to affect the neurotransmitters in your gut, then are going to affect your neurotransmitters in your brain, which then can lead to anxiety and depression and chronic pain because of the dysregulation of the amino acids in there and the chronic inflammatory process. Also, certain foods can cause inflammation in the brain, and you get inflammation in the brain that causes dysregulation of the brain chemistry and neurotransmitters in the brain, which then leads to anxiety, depression, and chronic pain. So there's a quick overview of those foods and how that causes a problem. We could dive into that a little further, but that's quick. Chronic infections can be related to it. So there's certain bugs that can cause damage to your mitochondria, which then lead to decreased ATP production in your body, which then is what your body uses for energy. And if your mitochondria is not working very well, you're going to be tired all the time and you're going to be in chronic pain. It's going to cause muscle aches and joint aches all over your body. Chronic infections like Epstein-Barr virus, cytomegalovirus, mycoplasma pneumoniae, chronic strep, chronic Lyme disease, and many others can potentially be related to what's going on. Or there could be some gut bugs like small intestinal bacterial overgrowth or certain parasites or candida hanging out in your gut that could potentially be causing all these things.
Are you saying that Epstein-Barr is fibromyalgia, or the Epstein-Barr virus can lead to symptoms that we call fibromyalgia?
Either or. So fibromyalgia could be all just you have chronic EBV infection, which is a reactivation of EBV, which 80% of the population gets exposed to. Most of us have had mono sometime in our lives, which is what Epstein-Barr virus causes mono. Mono is just a symptom picture. Epstein-Barr virus can go dormant, and then it can reactivate from chronic stressful event or being way too much physical activity can reactivate that Epstein-Barr virus, and then that can lead to those symptoms of fibromyalgia.
Okay, fantastic. So we've got the thyroid, adrenal glands, food sensitivity, chronic infections, and you're treating all of these things. You're looking at all of these things. What else?
So we talked about the mitochondria. We went into that really good. We need to work on healing up the mitochondria. We need to identify what's causing the damage to the mitochondria first, which we talked about the above ones. And then we need to work on healing it up. And several different nutrients are used to do that. We need to work on detoxification because a lot of people are exposed to a lot of chronic gunk. And some people do really well in detoxification. Their liver works really well, their kidneys work really well, and they're able to eliminate really well through their bowel movements. And they get exposed to a lot of toxic gunk, but they're fine. They don't have any symptoms from it because their body detoxes. But a lot of people with fibromyalgia, they don't detox very well. So we need to work on increasing that function, increasing their sweating function, increasing their detoxification in the liver and then the gut and through the kidneys and also through the lungs, which are our main detoxification organs that we have. So we need to work on doing that. And then obviously eliminating all the toxic gunk that they're putting in their body the best we can. We're not going to get away from all the toxic stuff we have, but we work on eliminating it the best we can and then help our detoxification organs work. We need to work on balancing out neurotransmitters because if there's an imbalance of your serotonin and dopamine and epinephrine and norepinephrine and all those, it's going to cause this chronic pain response and this chronic fatigue syndrome. And also, obviously, it causes the anxiety and depression piece. So we need to work on balancing those out. And we do that working on certain meditation, but also giving some amino acids to help balance that out. And then we need to work on balancing out the brain waves. So this is how our brain works, is through brain waves. We identified that through doing EEGs of the brain, and we can see little wave patterns when we do that. And then that's how our brain works. If you don't have brain waves, you're dead. So a brain wave affects how your brain works and how every function in your brain works. How you feel, how you move, how you concentrate, all that is based on the brain waves. So we can pick up what's going on with your brain waves with the EEG, and then we can modify those brain waves as needed if we see a dysregulation of those brain waves to get you feeling better.
Wow, that's a lot. Anything else?
No, that's probably enough. Probably everyone else is pretty overwhelmed already.
I mean, it's pretty overwhelming, right? But, you know, and I want to get to sort of like next steps, like a real tactical sort of thing here. But what I'm hearing you say is that fibromyalgia is it could be a combination of different malfunctions ranging from thyroid malfunctions, adrenal gland malfunctions, food sensitivities, et cetera, et cetera. And what the integrative approach does is it looks at all of these things to find out where the malfunction is, and then you build a protocol to start repairing those malfunctions. Is that what I heard you say?
Exactly. Good job, bud. You were listening really well.
I'm here to be the translator for you to the people. You know, you know what I mean? To filter it all through.
That's really good, man.
The average Joe filter here. So then let's talk about next steps here in terms of fibromyalgia. If someone's listening and they have symptoms like fibromyalgia or they've recently been diagnosed as such, you know, what are like some immediate next step tactical sort of things they can do?
Well, really, they need to go to a doctor that understands this, that is an integrative physician that understands all these potential causes that could be happening. If you go to a conventional doc, they're going to do what we talked about. They're going to give you antidepressants or pain meds. So you just need to find the right doctor for you that really is going to look at all these things. And just because you go to an alternative physician or you go to an integrative physician, they're not going to look at all these things. They might just do what I call green allopathy, which is they give you an herb to cover up a symptom. So they see that you have anxiety, depression, and pain, and they're going to give you turmeric to decrease your inflammation, or they're going to give you St. John's wort to help you feel better. This is not really identifying the cause, and it's not going to give you the total cure that we're looking for. So you just need to find a doctor that truly specializes in finding out the cause, treating those causes, first identifying those causes, eliminating those causes, and treating the damage that has been caused by those causes. That's really the integrative approach that I use to help my patients overcome their fibromyalgia.
And if you're in the Salt Lake or surrounding areas, or you want to do a virtual consultation with Dr. Jake, then go to integrativemedica.com. Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. integrativemedica.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.